Hey everyone, it's Anastasia, and this is Anastasia's Hump Day Happenings Neonatal Intensive Care Unit Awareness Month. I have 5 dental problems to share with you mothers or parents to look for when your baby is a preemie or born preterm. So just let's start it off. Born preterm means born prior to 37 weeks. Prior to 37 weeks. We're just going to start right into it. So number one of the dental problems to look for, and these aren't all by the book, but it is something that has been associated with preemies. So number 1 would be enamel hypoplasia. Enamel hypoplasia. So what in the world is that? So 4 weeks into your pregnancy, the enamel starts to form, which is so amazing, of the baby teeth. Here's the problem. You need calcium, phosphorus, and vitamin D, especially in the 2/3 remaining in the pregnancy. If you're born preterm, you're not going to get that. So something has to give, and the enamel will be very, very thin. So hypoplasia meaning it just doesn't have enough. It's got some, but we would prefer more. So what could be the problems with enamel hypoplasia? What you're going to notice once the baby teeth start to erupt, they could be a cream color, a yellow color, or even a darker color. Try as you may, because a lot of us, we like white teeth. You're not going to be able to brush that color off. Doesn't matter. As long as the baby teeth come in and they're in the dentition in the top arch and the lower arch, and guess what? They're only going to be there for a few years. They're holding the space for those permanent teeth, and that's what really matters. They accumulate more plaque, so know that. So parents, moms, your oral hygiene fitness regimen for your child is really going to have to be one that is structured. Because if you have plaque accumulation, you're likely to up or increase the risk for tooth decay. And you do not need your child to have or experience tooth pain or tooth decay, because dental decay is preventable. So this is about empowering you right now to have that impact on your child's life. The second dental problem to be aware of, it could be delayed tooth eruption. How will you know? I would say encourage the conversation between your pediatrician, your dentist, your dental hygienist during your health and wellness visit. All right, so then number 3, distortion of the palate. How would that happen? It's called a palatal groove. And it happens because when your baby is born premature, often there could be a respiratory illness or something like that where they have to have a tube down your baby's throat. So intubation between 1 day and 62 days can have an impact on the palate of your baby. So meaning instead of the palate being a normal palate, it might look like a V. And you might think, well, how is that going to impact my child? I'll tell you. It can impact your child by their ability to suck, whether it be for breastfeeding. It will impact your child's speech. It could have a speech impediment. It will impact a hearing, so they could have a hearing impairment, or more prone to sinus infections, breathing, if you will, because the palate being up so high, what's happening with the nasal cavity. So it can also impair or contribute to a crossbite or malocclusion as your baby teeth erupt. Number 4, most medications for preemies or as your child is growing, it has sucrose in it. So we're going to refer back to point number 1. If you have enamel hypoplasia and it's accumulating plaque and you've got tooth decay as a high risk, oh my gosh, what are you supposed to do? You've got medication that now has sucrose in it. Yes, I'm saying take the medication, of course, because if your child needs antibiotic, how are they going to get it down? They're more sensitive to a bitter tasting medication than what we are as adults. So of course you have to have that. Yet, it's in knowing the oral fitness regimen for that child and their teeth. So maybe it could be as easy as a washcloth to just, after they take that medication, you just wipe. It could be even, there are baby wipes that have xylitol, they're dental wipes. Ask your dental hygienist about this, because there's so much out there right now. It is incredible. Or you could start to brush your baby's teeth if the teeth, there's more teeth coming through. This could be a really good way to keep those teeth sound and fit. Then finally, the trauma from intubation, because again, respiratory issues, required medical ventilation, can contribute to more enamel defects. It's all about being healthy and knowing what questions to ask, which I'll include a PDF for you so you can have a little checklist on these top 5 dental problems that can be associated with babies who are born preterm. Now you got a question for me? Ask it. Otherwise, like my channel and join me every single week. And until next Wednesday, take what you learn and make a difference with it.